Okay, you guys, I am so excited today to welcome my friend and colleague, Dr. Laura Ricci. She is a licensed doctor of physical therapy specializing in women's health and pelvic floor rehabilitation. And she's also certified as a women's health and nutrition coach through the Integrative Women's Health Institute. That's a mouthful. And that's actually where I met Laura, is in the Integrative Women's Health Institute, where we were in the program together. So in addition to all of that, Laura is also currently completing a 2-year nutritional endocrinology practitioner training program through the Institute of Nutritional Endocrinology. So she is really an expert when it comes to hormone health, nutrition as it relates to hormone health, and just overall health and wellness, but also an expert in pain and all sorts of, chronic issues, which I'm going to let Laura get into because she has quite a story. She's been through a lot personally. And today we're going to be talking about food to help fight pain and manage chronic pain and chronic issues such as that. I know that a lot of you who watch are dealing with pelvic pain and low back pain and that kind of thing. So this should be really helpful. And I think we're even going to get to some really simple and easy recipes that are delicious as well. So Laura, thank you again for being here, and please introduce, fill in any blanks that I missed, and also tell us about your personal journey and how you got to where you are today.
Sure, absolutely. Thank you so much, Brianne, for having me here. It's such a pleasure to be here. I always have fun when we get to connect and see each other. And yeah, I kind of went on this journey, and it's funny to me to be talking to you about nutrition because that wasn't really my focus, especially in going to school and studying. I was really into the physical therapy, and really through my own pelvic pain challenges, got interested in pelvic floor physical therapy. We kind of study what we grow interest in, and I was really trying to figure out the issues that were going on with me. So I was diagnosed with vulvar vestibulitis or vestibulodynia, and I did a ton of stuff for that. We did medications and creams and physical therapy, pelvic floor PT for several years, and it wasn't really getting better. So I had a partial vestibulectomy, and that really didn't kind of do the trick for me. So after a year and more rehab, I actually went and had a complete vestibulectomy with vaginal advancement, and some things got better. I was able to wear like jeans and tight pants for the first time, and I was like, oh my gosh, this is really exciting. But other things like the painful intercourse weren't just completely clearing up for me. Mm-hmm. And so I kind of went on this journey, and during that time, I was getting sick all the time. I was getting yeast infections all the time, really bad periods, and the birth control pills or the options that they were giving me just weren't working well, and it was kind of crazy. I thought that something was wrong with my thyroid. I went to go see my doctor, and he refused to test my thyroid and said, you've got depression. You're depressed.
Oh my gosh. Oh, okay.
I know, right?
Okay.
Oh, and how many times do our patients and clients come to us with these stories?
Oh, that's just what I was thinking. It just is crazy. And I actually don't know all of this about your story, Laura, so this is really news to me too. So please continue. Yeah.
And I was like, that is not what this is. I know I'm not depressed. I'm pretty sure it's something to do with my thyroid. I had a family history of that going on. So I refused to take the antidepressants, and I got a second opinion, and I saw my OB-GYN, and he palpated my abdomen and found a mass. And we thought it was a hernia, and we went in and did some imaging, and he said, no, it's not a hernia, it's a mass. And it was very, very painful, and it was growing very rapidly so we decided we need to get it taken out and figure out what it was. We had a biopsy. The biopsy said it was benign, but it was just so extremely painful that we were like, okay, let's get it out. Well, lo and behold, initially with the scan, it was about golf ball, racquetball size, and then by the time the surgery came around, it was softball size. So it was very aggressively growing. And 2 weeks later, the pathology came back inconclusive, and they sent it off for more tests. And I thought, oh, okay, this isn't good. And then 2 weeks later, it came back that it was a desmoid tumor, which is a very, very rare sarcoma, like 900 new cases a year, about 2 to 4 million people get them. So then I was depressed.
Yeah, there you go.
Oh, okay.
Because my gosh, how old were you at this time that you couldn't have been more than in your late 20s? Mid-20s, yeah. Okay. Yeah.
And you never think that you're going to get a diagnosis like that. And it was just crazy in so many ways because I just wasn't ready for that. And I went from, we got it all and it's not cancer, to we didn't get it all. There were still positive margins, and it is cancer. So really, I share this because this has been a theme in my healing journey, is always, always, always get a second opinion. And we went to MD Anderson Cancer Center, and I'm so grateful because they actually have a team specializing in that. And they said, you've got a 50% recurrence rate, which isn't great. That's like flipping a coin. And told me, you're too young for radiation. It'll fry your ovaries. We're not going to do more surgery because these are microscopic positive margins. We're going to take a wait and see approach and do scans every 6 months. So that's what we decided to do. And I'm very grateful for that. Now, at this time, I was like 50% recurrence rate. What can I do to empower myself to prevent this from ever coming back? And I was told, just eat the standard American diet. Crazy. So I went searching for answers, and I went on this journey, and through that, there was a lot of challenges. The synthetic mesh that they had put in my abdominal wall, because it had eaten through that rectus abdominis muscle, part of that six-pack muscle, was herniated. That synthetic mesh herniated, and they put more in, and it herniated again. And we ended up doing this really big reconstruction where they took all the mesh out and they built me a new abdominal wall. And during that time, they said, you can't work for a year. You've had 2 hernias. You can't lift anything over 5 pounds. You can't go back to your job as a PT. And I went through this internal struggle of, who am I without physical therapy? And what am I going to do? And I found Jessica Drummond through the Integrative Women's Health Institute that we were talking about. She became my health coach. I started changing my diet and noticed improvements in a lot of different areas, and was like, I have to learn more about this. So I took the year-long certification, the one that we met and we're in together. And by changing my diet, so many things improved. But there was also some lingering things like daily headaches and fatigue and just a few things that didn't get better. And I thought, I'm eating too clean for this. And when I had seen doctors, I was told, it's fibromyalgia, it's chronic fatigue syndrome. There's nothing that we can really do for you. And I was like, no, like there's something else going on. And actually read an article that Dr. Rita Murray in the Institute of Nutritional Endocrinology shared with us. And I had all the symptoms. I thought, oh my gosh, and it was about this young girl who went through challenge after challenge, and it turned out to be Lyme disease. And I got tested for that, and that came back positive. So that was kind of crazy. That was another journey that we went on, and found a Lyme literate medical doctor and started getting treatment for that. In all of this, I found out I started having hip issues, and I was like, what is going on? And found out that I had adult hip dysplasia. So I had some hip preservation surgeries, really big surgeries called periacetabular osteotomies, where they basically fracture your pelvis and separate it from the hip socket, reposition, and get you better coverage to basically build you a new hip joint. So it's bigger than total hip replacement. And I had labral tears and impingement and lots of things wrong with my hips. And I thought, oh my gosh, this underlying pelvic pain that I've had that got a little bit better after some of these surgeries and the other things that we were doing, but didn't completely clear up with nutrition and some of these other things. There was a anatomical issue. There was a hip pathology issue, and the hip relates directly with what's going on with your pelvic floor. Yeah. So I went through kind of a journey with that, and had those surgeries back in 2014. 2 years later, was still having a little bit of hip issues, found out that the labrums had retorn, that there was still some underlying impingement. So I really sought out a surgeon specializing in microstability of the hip and subspinal impingement and all of these interesting things that I didn't even learn in PT school. Yeah. And I just had 2 hip surgeries, one in December and one just about 5 weeks ago, and I'm healing from those. So this is kind of taken me along this journey, taught me that second opinions are crucial, can save your life, can completely change the outcome for you, and really brought me to specialize in nutrition for pelvic pain, nutrition for Lyme, and also nutrition pre and post surgery to help optimize your outcomes. Oh, so that's kind of a crazy journey.
It is a fascinating journey. And what just always gets me about you is you have been through so much at such a young age, and you have the best attitude about all of it. It's inspiring, and I just every time I hear bits and pieces of your story, I just shake my head and say, wow. So I love this. So tell me about food and how it has helped you personally with all of this stuff you've been dealing with.
Yeah, absolutely. Because food has been a big piece, and that's what really encouraged me to learn more, to start a virtual health coaching practice, to just dive deeper into this because I was fascinated by it, but really just an anti-inflammatory diet. So going back to eating real whole food, and if it looks like a chemical science experiment, don't eat it, and really becoming a label reader, diligent label reader, where we're looking at those things and we're looking at those and getting rid of the chemicals and the processed food and that stuff. And it was fascinating to me because I went through an elimination diet, and I later found out that kind of those top food sensitivities are gluten, dairy, sugar, soy, corn, peanuts, and eggs. And I had a sensitivity to almost all of those.
Yeah.
And what was remarkable to me was I had very painful periods, very irregular periods. My cycle would be anywhere from 13 days to 65 days. I never knew what was coming. I felt like I was living in this constant state of PMS. And with tweaking my diet and specifically taking out the gluten, dairy, sugar for 3 months, my cycles regulated to 28-day cycles, something that had never happened for me before in my life. The painful cramps, the heavy bleeding and clotting, all of that cleared up, went away. And interestingly enough, I had knee pain that as a PT, I was working on trying to relieve, like, okay, strengthening, stretching, iontophoresis, ultrasound, all of these tools that we had in the clinic wasn't working. But I noticed 3 months into changing my diet, that went away. And I was like, this is amazing. I was having migraines maybe 5 days out of the week. I literally don't know how I got through PT school because I was studying with ice packs on my head, and those cleared up. Now I maybe have like 2 or 3 a month, and I can control those with essential oils and some other things. So it's really interesting to me that it made such a difference. And I'm seeing that now in my health coaching practice of helping people to kind of target and find the right diet for them. Because I don't think that there's one magic diet. I don't think everybody needs to be vegan or everybody needs to be paleo, but it's about really tweaking and finding what works for you and your body. And you're the best gauge of that by how you respond to different things. Like I found out in my case, grains, even gluten-free grains, I just don't tolerate them well. They're inflammatory for me. They cause a little bit of inflammation, and my skin will kind of break out after I have grains. And it's an interesting journey, but food is huge. I feel like we forget that it has a contributing factor to inflammation in our body, that it can cause our immune system to kind of overreact, and that pain can surface kind of where our Achilles heel is. So for pelvic pain, like it can be in the pelvis or the hips or in other areas of the body, and that it really has a systemic effect on us. It's not just what we typically think of as food allergies, as like, I'm allergic to strawberries or I go into an anaphylactic shock. It's kind of that low grade inflammation that's constantly going on in our bodies.
Yeah, absolutely. And I mean, if you think about it, I love what you were saying about how you were kind of trying to work on your knee with some PT exercises and that kind of thing. But it's really interesting because, you may do an exercise for 5 minutes or 10 minutes at a time, but really you eat 3 meals a day plus snacks. I mean, you're eating all day, all the time. So of course, if you're eating the wrong things and it's causing the wrong things for your body with that bio-individuality that you're talking about, then of course it's going to cause that underlying inflammation. But you're right, it's not something that many of us think of when we think of helping ourselves. We think, well, I'll go do an exercise, and that's going to help it. And exercise is great. Obviously, I love exercise, but yeah, it's the stuff you're doing all day long that really adds up. So yeah. How do you suggest people get started with kind of determining what might be triggering them and their symptoms?
So that's a great question. I really recommend an elimination diet, and that's where I take my clients through and kind of help them and support them. Before that, though, just adding in more nutrient-dense foods, crowding out the processed foods and the junk, and slowly adding in more fruits and vegetables, ideally leafy greens, water. Oh, hydration is so important.
I have my water.
For inflammation. Yes, we have. Yes. We just
my water.
Take it with us everywhere.
And I love that you're saying adding in. I think that sometimes people think of nutrition nutrition work with somebody or diets or elimination diets, they hear the word no and elimination and taking things away. But I love that you're focusing more on what you can add in versus what you're going to necessarily, I mean, you'll take out at some point, but I like that your focus is more on the adding in. I think that's cool.
I think it's really helpful in the beginning, especially because so many people have this all or none mentality. And it's like, if I'm not doing everything perfect and eating everything, it's like not worth it and it's not helping me. And it's like, no, actually just getting in more water, starting with the basics, because if you're not having 2 to 3 well-formed bowel movements a day, there's an issue going on with your detoxification pathways. Like, you're not clearing out that stuff. And plus, constipation is really common with pelvic pain. Usually it's not just the pelvic pain, right? It's IBS or diarrhea or bloating or these things. And when we have constipation, that's going to be really hard on our pelvic floor. Yeah. And that can stretch muscles, that can stretch the pudendal nerve, that can cause us to strain more often. It can put more pressure on the bladder, on the urethra, all of those things that can contribute to, increased urinary frequency or urinary incontinence or leakage or anything like that. So we don't often think about maybe pelvic floor or our bowel movements and tie that in with nutrition and what's happening with our pelvic health, but it really is all related, and it's taking that holistic approach to what's going on with our body and realizing that, wow, what we eat can affect our bladder health, our pelvic floor, constipation, all of these things, and just help us to feel better. And so starting slow.
So water, you said water is a great one. I know you've also talked, and another thing that I watched with you recently, it was your green smoothie party online. Yeah. I love that. Was so great. You were mentioning that there's actually, it seems as if to me, the guidelines have been bumped up a little bit as for what is needed and recommended for fruit and vegetable intake per day. It's 1 pound of fruits and vegetables per day and 10 servings. Is that right? Yeah.
Yeah. The World Health Organization recommends 10 servings.
10 servings.
Fruits and vegetables a day, which is hard to get for the average person. Mm-hmm. And then it was interesting. I went to a lecture and was listening to a functional nutrition doctor talking, kind of a functional medicine doc. And she was saying that really 1 pound of fruits and vegetables is ideal for the person. And I thought, wow, that's really interesting. And also it could be a little overwhelming for people. So I don't want people to hear that and think, oh my gosh, but just slowly. And you actually don't want to go 0 to 60. Yeah. You won't like me very much if we just go from eating no fiber to a whole lot of fiber, but set goals for yourself and like a green smoothie, throw in some leafy greens in there, chop some up and put them in your sauces or things, add them to different meals that you're making and just kind of sneak them in there. And a little bit really adds up over time, and you'll start to see a difference and feel a difference in your body.
Yeah, I love that. And actually, I've known about green smoothies for a long time, and I've had quite a few green smoothies in my life. But your talk recently really inspired me to increase the greens in my life, the green vegetables. And so I've been having a green smoothie, a very low sugar green smoothie with my breakfast every morning, because I personally need more than a green smoothie in the morning. I am a big eater. I love food, and I wake up starving. And so I've been having my egg, and I have some paleo bread that I like to eat, and then I've been having a green smoothie, and I feel so much better when I start my day with green vegetables, greens, and it's just delicious. And I love your smoothie recipe. I know that's one that you were going to share with us today, I think.
Yes,
you had a few recipes, so maybe we can dive right into some of those recipes, and feel free to sprinkle in any other bits of wisdom about anti-inflammatory eating for pain as you go, but I'd love to hear your recipes.
Sure. Yeah. And as we kind of go through these, I just want people to realize that really we're cycling through about 5 to 10 recipes that we're really going through and making every night and doing. So if we just make little swaps and upgrades, it takes it from feeling really overwhelming to, oh, I got this. Like, oh, this is a really, really good one. We're going to cycle this in, and it just makes it a little bit easier. So the it's my mint chocolate chip green smoothie. And I came up with this because I wanted it to taste really good and be really restorative too. Because if it doesn't taste good, we're not going to eat it, right? Yeah. It's just not going to happen. Mm-hmm. So I do about 1/4 to a half cup of ice, because I like my smoothies to be kind of ice creamy consistency, kind of like a Frosty from Wendy's consistency. a really large handful of organic spinach or organic greens, getting a variety and play with it. You may find you like one more than the other, but usually for people just starting out, spinach or romaine lettuce, they're a little less bitter and a little bit easier to kind of add in when you're starting your journey with this. I like a really clean chocolate protein powder. There's several. I like Thorne Mediclear SGS is one that I like a lot. JJ Virgin has some clean protein powders that are Elimination Diet compliant, Science for Health. Any of those places are really great. I also like to add in a little bit of collagen protein powder, so about 1 tablespoon of that, because ideally for most people, and the interesting thing as I get into this work is many people have an underlying insulin issue. They've got an issue with their blood sugar. And if we can go higher protein, lower carb in the morning, that can really help to support the adrenals and keep you satiated and feeling better with your blood sugar. So doing just the protein powder may not be around 30 grams of protein. I shoot for 30 grams within 30 minutes. So adding in a tablespoon of a clean collagen protein powder. I like Dr. Axe has one. Bulletproof has a really nice collagen powder too. So any kind of clean collagen from grass-fed cow sources is nice.
I like the Vital Proteins brand. The Vital Proteins is a nice one. Mm-hmm. Yeah.
Absolutely. That's a really nice one. Mm-hmm. And then we need fat. So you're thinking fiber, protein, fat to stabilize your blood sugar levels, help you feel good, help those adrenals out. So I like to do, it's anywhere from 1/4 to 1/2 of a cup. You can start small on this, but of the full fat canned coconut milk, and I like Native Forest because they have a BPA-free liner. Yeah. And just put some of that in. That's going to make it taste really creamy. It's going to keep it dairy-free and just be really nice to kind of add in that way. You can add in water if you wanted to, or coconut milk or almond milk or something like that, kind of depending on your preference. And then to add the mint in, I really like peppermint essential oil. So you just want to make sure that your oils are safe for internal use. Check with the company. I know you're a big essential oil fan with me.
We love our oils over here. But yeah, the peppermint, and you only need 2 drops of the good, really pure quality that is safe for internal use. You only need 2 drops. I've been making this smoothie again, I think for the last 3 mornings now, and it is really good. It's not really sweet, but it's really flavorful, and I like to add a little extra cacao powder because I really like the chocolate aspect, but it's really good. So, and actually,
if you're not a mint fan, wild orange oil would be a nice one too.
Oh, that sounds really good with the chocolate. Yeah. I was going to tell people you should be grabbing a pen right now because these recipes are really good, but I think maybe you might have links to them that maybe you can share as well, Laura, or I can also write them down. Either way.
Yeah, definitely. We could find something out or add an image or something that way too.
Perfect.
Yeah, absolutely.
Perfect. Okay, perfect. Yeah, so that's a great way to start your day. And I think that I know that you had some other ones for other meals of the day that we had talked about sharing today. Do you want to, I love how you said, just swap out kind of one at a time. Just try one at a time. It doesn't have to be like all or nothing, but making these very simple, slow, and steady swaps. So what else do you have for us?
So let's swap coffee.
Yes.
That's a big one.
I love my coffee.
Right? It's tough. And there's a time and place for it. The issue with coffee is it is acidic. It can weaken the lining of the gut. So when we're talking about leaky gut and healing things, it can be really hard on the adrenals. So if you're having to have it to get up and get going in the morning, that's maybe when we need to talk and not stop cold turkey, right? But slowly come off of that and transition. And something that works really nice is Dandy Blend tea. I really like this because it's a gluten-free option. It's clean. It's going to be alkalizing for you. And it smells, looks, and tastes as close as you can get to coffee. I'm not going to tell you it's going to taste exactly like your coffee, but it's going to be really, really close. And I came up with a pumpkin spice latte for people because we all know, right? You go to Starbucks and oh my gosh, there's not even real pumpkin in that thing.
No.
And it's just a sugar bomb and yuck. So we came up with a better way. So I just do 8 ounces of hot water, pour in the Dandy Blend tea, and they actually come, you can do just a teaspoon, or they come in little travel packs, and you can just dump one of those in there, which is nice.
Now, question real quick, Laura, where do you get your tea? I've actually never, now I live in Germany, and it's not always the same as in the States, but where do you get your Dandy Blend tea? I haven't
I
seen
actually
this.
buy it on Amazon.
Really?
I love
Okay.
Amazon.
Okay.
Yes. I'm an Amazon Prime fanatic. So, yeah, just search Standy Blend Tea. It comes in a big packet where you can actually pull out the powder and put it in. Or I really like the little individualized single servings for when you're traveling to have on the go with you.
Yeah.
But that's nice. So you can start with a small pack and see how you like it before you get the big bag.
Yeah.
And do that. And then I do 1.5 tablespoons of organic canned pumpkin. And again, if we're going to get things out of the can, look for a BPA-free liner if you can. And then a teaspoon of some organic vanilla extract. And you'll notice a lot of my recipes will use stevia just to be lower glycemic, because I know a lot of people do honey and maple syrup, but the more that I tested my own blood sugar levels and then those of my clients, it really tends to spike people. So I like stevia as a natural sweetener. So my favorite is the sweet leaf stevia drops, which you can also get off Amazon. And for this recipe, I like the English toffee flavored because it kind of has kind of a mapley syrup. It goes nice with the pumpkin. So you can put like 5 drops in there of that and play with that. You may find less is usually more with stevia, so you can adjust as needed. And then 2 tablespoons of the Native Forest canned organic coconut milk again, because we want some fat in there. Yeah. It's going to keep you satiated. And then just like a teaspoon of pumpkin pie spice, or you could add a drop of cinnamon essential oil to support your blood sugar, something like that. Blend it up. It makes this really nice froth at the top, and you can pour it in your mug, and it's just awesome for something to have in the morning, or especially kind of fall, winter time. I guess maybe we're still kind of in winter a little bit, so we could still enjoy this.
I like pumpkin spice all year round. It's just such a homey, comforting flavor. I love it. I'll drink that in the summer. So I am trying this. I've got to get me some Dandy Blend tea, and I do love my coffee, but it probably would be good to alternate mornings with maybe something like this. So
you could just play with it, or add half and half, or it's a nice option. To try.
I love that. Okay, great. So we have a smoothie to start our day with some greens and some anti-inflammatory goodness there, some protein, all that. We have some a coffee replacement, because that could be causing some blood sugar roller coaster stuff and some acidity, leaky gut potential issues, which ultimately inflammation. What else do we have? This is so fun.
So I kind of created a soft taco upgrade, or a taco salad. Actually, it was inspired by one of my clients, because she said, does that mean I can never eat tacos again? I was like, absolutely not. You can totally eat tacos.
Yeah.
We're having tacos. So Taco Tuesdays are back.
Yes, Taco Tuesdays. Love it.
We're making it happen. So this is really just doing a couple swaps. And I love this because this is an example of playing in the kitchen, upgrading things, and just making foods that you still love, just swiping ingredients and upgrading. So for the meat, we're going to upgrade to organic ground beef or bison or turkey, some kind of organic animal protein there. So about 2 pounds. I chop up an onion and kind of cook that up with some coconut oil. So like 1 medium onion and about a tablespoon of coconut oil or avocado oil, and heat that up. Ground up and just brown your organic meat. And then I add in like 14 ounces of some organic tomato sauce. Mm-hmm. And I always opt, if I can, with tomatoes to get it in the glass containers if possible.
Yeah.
Because just the acidity of the tomato can really leak into those linings of the canned tomatoes. Mm-hmm. If you have the option, great. You do the best you can. Mm-hmm. And then I also like to season it. Seasoning things makes them taste really, really good and so fun. So you could add some chili powder. I like to do 2 tablespoons. You could cut that in half if you don't like things spicy. My husband, I like things spicy. About 1.5 tablespoons of cumin, or you could do a drop of cumin, essential oil. Mm-hmm. I like to use oils with cooking too. You could do 1.5 tablespoons of paprika, a tablespoon of some onion powder, tablespoon of garlic powder, 2 teaspoons of oregano. And just mix that all up, and it really just makes a really amazing kind of taco mix for you there. Instead of the taco shell, or instead of the flour tortilla, we're going to upgrade to a paleo wrap. I love these. These you can get on Amazon as well. It's just coconut. It's just coconut. And it's amazing. So it's got fiber. It's low glycemic. It's not going to spike your blood sugar. It's grain-free, gluten-free. Awesome. So I just put that on my paleo wrap. I put some holy guacamole on top because that's a really clean brand, or just, be a label reading gangster when you're getting your guacamole and check that there. Some mixed greens because vegetables, so put a ton of greens on top. And I even like to do a drop of lime essential oil or some fresh squeezed lime. And then some cilantro, if you like cilantro, because it really helps with supporting heavy metal detox from the body. So you could do that. Or even better, if you wanted if you're working towards that pound of greens, you can just make a big bowl of greens and cilantro and put that taco mix that we just made on top with your guacamole. So you've got protein, fat, and fiber all in this really nice meal. Leafy greens are very supportive of detoxing estrogen from the body, of supporting your liver detox. So if people are struggling with like endometriosis or fibroids or cysts, which estrogen is kind of that building up hormone, the more leafy greens that we can get in, the better. Yeah. So it's kind of an upgraded taco idea.
That's great. And another leafy green that's great for, correct me if I'm wrong here, Laura, but I'm pretty sure that the cruciferous veggies, which would include cabbage, correct? Yes. Mm-hmm. So I believe that would be also an excellent estrogen detoxifier as well. I'm kind of going off the fly here, but I'm pretty sure I'm saying the right thing.
Like put some purple cabbage on top. I love that idea.
Or use it like a taco, just a taco shell. Your cabbage leaf, if you can peel off a good cabbage leaf, you can use it like a wrap. If you don't have the paleo wraps, you can, because I've made soft tacos out of cabbage leaves before, and it's delicious. You can, eat it like a taco. It's great.
I love that idea. I make stuffed cabbage rolls, but I have not used that as a taco shell. I need to do that. That is fantastic.
It's good. Okay, good. So we've got breakfast, we've got coffee, we've got lunch, dinner. Do we have dessert?
Of course we have dessert. We need dessert in our lives, right? So as we're transitioning to summer, I basically was kind of inspired by Elena's Pantry. I follow her a lot, and I follow Danielle Walker from Against All Grain. Mm-hmm. And I kind of took two of their recipes, created my own, and made it lower glycemic. So I've come up with this chocolate pudding popsicle, which is kind of an upgraded fudgesicle, if you will.
Oh, like Bill Cosby pudding pops, right?
Yeah,
the Cosby, Bill Cosby,
exactly. So these are really simple because we just throw everything into the blender and blend it all up, and then we pour it into popsicle molds or even, little ice cube molds, whatever you kind of have, and then freeze it. So this is a really nice thing for summer that's coming up or as it gets warmer. So I use a can of the full fat unsweetened coconut milk. The Native Forest, again, is my favorite. Put that into the blender, and then I do a 1/3 cup of Lily's dark chocolate stevia sweetened chocolate chips. Have you tried Lily's chocolate chips?
I have not tried these. This sounds wonderful.
They're so good. So I actually can find them at my local natural grocers, but you can also get them on Amazon.
Okay.
Of course.
Yeah.
And Amazon, if you're watching us out there, we need to put links or something.
Right? Sponsored by Amazon. Not really. It's not.
Sponsored by Amazon,
it's not.
Yeah. But the Lily's is great because they're vegan, they're sweetened with stevia, they're lower glycemic, and then about 15 drops of vanilla sweet leaf stevia. This is a science here. This is what I found works for me, but you could do more or less depending on your taste buds. I always do a little dash of Himalayan or Celtic sea salt because it brings out the sweetness in this a little bit. Yeah. And then a teaspoon of vanilla extract or vanilla powder. And you just blend it up really good to where it's combined really, really well. And then just pour it into your molds and let it freeze for 2 hours. And you have this amazing, just kind of upgraded chocolate pudding popsicle that is awesome. That my husband's a very meat and potatoes kind of person. And he was like, oh, these are really good.
That's great. That sounds really, really good. And just perfect for your sweet tooth, which, I do. I have a chocolate tooth. I don't even need it to be sweet. I just have a chocolate tooth. I love chocolate. So this sounds really yummy. I'm going to have to try these chocolate chips. Yeah, that's so great. So we have the pudding pops, we have the coffee alternative, we have the green smoothie, we have the soft tacos. And I love that the pudding pops and the soft tacos too, the filling for the tacos, it seems like both of those recipes are very kind of make ahead, and you could really have leftovers. The pudding pops for sure, you could make them ahead and have them throughout the week. And even the taco filling, it's a pretty big recipe there. You probably could portion that out for a couple of meals. So I like that. Anything to make life easier is wonderful.
Absolutely.
Yeah. I have one recipe that I'd love to add and share to the mix because I know you and I had talked about turmeric beforehand and how great that
Yes.
can be. Turmeric is a wonderful anti-inflammatory agent for the body, very great for pain. And so I really like making hummus, again, thinking kind of make ahead items. I like to make a big batch and then just eat on it throughout the week for snack time. Take out a little bowl full of my hummus, or you can even use it as a spread for a wrap or a sandwich or something like that. I don't tolerate beans that well. I think that Laura and I have very similar guts.
Yeah, I don't do well either with beans. We do.
Yeah, we do. And although I eat gluten-free, I'm 100% gluten-free. I've been that way for almost 12 years now. But I don't do grains very well either. And I do eat gluten-free grains now and then, but I do notice that they can get to me over a period of time. If I have too many, it really causes problems. But again, same thing with beans. I love beans, but I find that too many can be a problem for me. So I like to make hummus with no beans. Gut health is really important for pain, as we've been talking about. So I like to use butternut squash as a base. And so I'll roast up one small butternut squash or half of a large one. They're all different, but kind of if you're thinking like, this big, then that's okay. But if we're thinking like one of these guys, just half of that, roast it up. And then you blend that in a food processor with half a cup of tahini, which is sesame seed paste, a scant 1/4 cup of lemon juice, freshly squeezed, a small garlic clove, 1/2 to 3/4 teaspoon of the Himalayan sea salt, 3/4 teaspoon or 1 teaspoon of cumin, 3/4 teaspoon or 1 teaspoon of turmeric, and 1/4 teaspoon of ground black pepper. Ground black pepper can help with the properties of turmeric, make them more effective in your body. So you can also add some smoked paprika or some chipotle and then blend that all up in the food processor, and it's really great with veggies or whatever you want to dip in it. But it's a really nice alternative if you do have problems with too many beans in your life, because hummus usually has chickpeas or garbanzo beans as kind of the base. And so I really love using butternut squash. It has a slightly sweet flavor to it, and the texture is just perfect for food processing up into a hummus. So that's my addition to the mix.
Amazing.
Yeah, I think.
Oh man, I'm gonna have to try that for sure. That
it's
sounds so
really good. It's golden hummus. And it's a really pretty color too. It's kind of a golden orangey, beautiful color. So you can impress your guests the next time you have guests over. And I think we have an amazing, really week full of anti-inflammatory pain-fighting meals. And that's only 5 easy recipes. I love it. So cool.
And they're quick. These don't take very much time.
No, not at all.
Have fun in the kitchen.
I agree. I think that's the biggest thing that you just said right there. Just have fun, because this is one way that we can take control of our pain and take control of our lives. It's empowering, and it should be seen as empowering, and it should be seen as fun and exciting and an adventure, because you're not always going to get it right. And there's definitely going to be, you're going to make mistakes in the kitchen, and you're potentially going to make mistakes in what works for your body and what doesn't. So, but I think if you take a light approach with it and kind of learn from like Laura and her sunshine personality, she's been through a lot, and she is still having adventures and doing awesome. It seems like you're doing really great with all of it, that you're in your personal journey.
That's really a testament to the nutrition. I tell people I am a living, walking testament to this, because I wouldn't be able to go out and teach and do my health coaching practice and all of these things if my nutrition and my self-care and those things weren't on point. And I will say it's fun. Like, use these recipes, get a couple recipe books. I really like paleo ones just because they are going to be lower glycemic and you don't have to worry about the gluten and the dairy. And play, and you're going to make things that taste amazing, and you're going to save them, and you're going to make ones that don't taste so good. And I actually write in my recipe book, this was really good, try this. And then I'll write, this was not good, do not make this again. But it's not about making the perfect meal or doing any of this perfectly. It's about getting in the kitchen, making a mess, having fun, and it's just implementing. Like 80% of this is just executing things, showing up, playing, trying it. and seeing what happens with that.
Yep. And knowing that you don't have to be perfect, but every little step toward making a positive change is going to make an impact over time. I think that's one more thing that I'd like to add from my personal, I haven't dealt with what Laura has, and I haven't really dealt with pelvic pain, but I've dealt with major GI issues, and then that transition to going gluten and dairy and soy free many, many years ago. I didn't notice changes right away. I was like, this is BS. This isn't real. I don't have issues with any of this stuff, because it wasn't like snap and instant quick fix. It took time. It took a solid month for my mom actually to notice the change in me. I didn't even notice it because I was living my day-to-day life, and I just thought, oh, I'm missing my bread and I'm missing my pasta. But my mom noticed the change in my voice. She noticed that I was coming out of my depression funk, and I just sounded lighter and happier and clearer. And so know that with pain too, it probably won't make an overnight, in an hour fix, but over time you may notice a difference if you're consistent with the changes. So,
absolutely.
Yeah.
Absolutely. It's like a 1 degree change with like each little thing that we're doing. But if you think about, okay, in 180 days from now, we're going in everything's changed.
Yeah.
So it's those tiny little steps, and it's just about being consistent and forgiving yourself along the way. We all mess up. Okay, just get back on the horse. And if you can find a friend or get a support system or something there too to implement, that can really make a difference and help.
Yeah. Wonderful. Oh my gosh, this has been so much fun. How can anybody get in touch with you who wants to get in touch with you? How can they find you, and what are you up to these days? Tell us about how we can connect.
Sure, absolutely. So my website is Laura Ricci. It's LauraRicci.vpwebs. That's like V as in Victor, P as in Paul, web.com. And that's where I kind of have my health coaching stuff and things there. I am on lots of social media. So I'm on Facebook and Instagram and Periscope at Dr. Laura Ricci. Okay. You can find me there. You can find me on YouTube by searching Dr. Laura Ricci on YouTube. And those are just kind of where I hang out. My email, if anybody has questions about any of this stuff, it's womenshealthcoach@gmail.com. And please feel free to connect, find me on social media, and I would love to get to interact and meet with you guys.
Wonderful. And I will put all of the links that Laura just mentioned, as many as I can remember and get down, in the video description below. Laura, you tell me if I miss anything. And I will also, somehow Laura and I will connect, and we'll get you the images or links to the recipes that she shared. So I am super excited to have met with you today virtually and to have had this conversation. I love these easy recipes, and thank you again, Laura. Thank you all for watching, and we'll see you next time. Bye.
Bye.